Hello everyone and welcome back to our CT console. First of all, I would like to thank you all for giving tremendous positive feedback on our CT viewing series, and that is why we are going to upload more videos on this series so that we all can learn radiology together. So as I have always said, it is always best to learn CT scan and view your CT scans on the CT console with your radiologist. So this is the third part in our CT viewing series, and today we are going to see the formation and course of the portal vein. This is because last time we saw the celiac axis, so I thought that we'll complete upper abdomen, finish the portal phase, and then go ahead with organs and the CT anatomy of the lower abdomen. So we will keep modifying our approach as we go ahead. So let's dive into the CT console now. As we all know, portal vein is formed by a union of splenic vein with the superior mesenteric vein. So this is the coronal section of a CT scan, which is contrast enhanced, and we are in the portal phase so as to make it easy to understand the formation and course of the portal vein. So coronal section, contrast enhanced, CT scan of the abdomen. As you all know now, this structure is the spleen. So what we need is we need to identify splenic vein and the superior mesenteric vein. So I will show it first in the coronal, because usually we look at the portal vein in the coronal plane and then go in the axial plane. Of course, for all the structures you need to see all the three sections to understand the actual anatomy. So spleen, and what we have to identify now is the splenic vein. So as we move our console, as this is the portal phase, the structure which will be very white or enhancing in color will be the splenic vein, right? So if you can see, I will trace the structure for you. Splenic vessels are tortuous. So now I think by now you should have identified the splenic vein, right? This, where my cursor is pointing, is the splenic vein. Yeah, that structure is the splenic vein. So now let me mark it for you. Starting from the spleen, usually the splenic vein can have multiple branches as it goes towards the spleen. Then it is going here. It is a tortuous vessel, so you need to move your console front and back. It's going something like this. Then going here. Somewhere over here, right? So this is the course of the splenic vein. Let us trace it again. You can follow the dot. I will start again. Follow with the cursor along the marked area, and that structure is the splenic vein. This and this. So I think now it's clear, the splenic vein, and it is joining something here. So that area predominantly has to be the superior mesenteric vein. So now let us trace the superior mesenteric vein. There, if we see, this is the superior mesenteric vein. right? So the splenic vein and the superior mesenteric vein. I will show you the tributaries of the superior mesenteric vein, but first we need to know how they form the portal vein, right? This is your portal vein. So see the anatomy again. Superior mesenteric vein and splenic vein both unite and form the portal vein, right? This is the portal vein. So let me remove all the markings and show it to you again. This is the splenic vein joining the superior mesenteric vein, right? And there they form the portal vein. Okay, this is the portal vein. Now we know that portal vein goes in the liver and divides into right and left branches usually. So again, this is where I like to review these scans in coronal images, because it becomes easier in coronal images to identify these branches. So as you can see, this is the left branch of the portal vein. Again, I'll mark. This is the course of left branch of the portal vein in this patient, right? And then it is like this. So this is the umbilical fissure, how the vein travels there, right? So left branch of portal vein. If you have not seen the liver anatomy series, I have already described the CT scan and the portal vein anatomy there. This is just to identify these vessels on the console, right? So left branch of portal vein, and it gives branches to 2 and 3 on the left side and branches to 4 on the right side, right? That is how the left branch of portal vein divides. So I'll remove all the markings so that you can see. We again go to the origin, right? This is the left branch of the portal vein, and intrahepatically it is giving branches to 2 and 3 and 4, right? Small branches, multiple branches to segment 4, right? That is how this part of liver anatomy is defined. So again, left portal vein coursing there, right? And giving branches to segment 4 and segment 2 and 3, right? So this is the course of left portal vein in this patient, okay, giving branches to 2, 3 and 4. The branches towards the left are branches to segment 2 and 3, and the branches towards the right are to segment 4. Now tracing the right branch of the portal vein, right? That is the right branch of the portal vein. Okay, this is the portal vein. So right branch of the portal vein. As we go towards the kidneys, we are going posteriorly. So the posterior segments are 6 inferiorly and 7 superiorly. These branches are given by the right posterior portal vein, right? So if you can see this one and this one, this is the branching of the right posterior portal vein. I am going posteriorly, and you can see these branches here. So tracing the right posterior portal vein along the marked area, you can see the branch here, which is a branch to segment 7, this one, and it is joining this branch, which is the branch to segment 6, right? Because I am going posteriorly. So 6 and 7 unite to form the right posterior portal vein, I'll remove the markings and keep only the right portal vein. So now when you follow this as I go posteriorly, it is dividing into two branches, which are branches to segment 7 and segment 6. Right? So segment 7 and segment 6 branches joining the right posterior portal vein. Now as I come anterior, where you can start seeing these are the two other branches of the portal vein. And how you can identify them? You can identify because I am coming towards the gallbladder. So I am coming anteriorly, right? So now the two branches that will come are the right anterior, right? This is a branch to if you can see the two branches, right? These are the two branches that we saw, segment 6 and segment 7. As I come anteriorly, you will again see similar two branches, and they are segment 5 and segment 8, right? This is the branch to segment 8, which is always vertical, and a branch to segment 5. Again, we'll see these branches in axial cuts also to get better orientation, but now you know right branch of the portal vein giving right anterior and posterior. Right posterior is giving branches to segment 6 and 7, and right anterior is giving branches to segment 5 and 8. And on the left side we have already seen branches to segment 2, 3 and 4. Now let us see some of the branches or tributaries that are very important to know in the area of the pancreas. And the first that you should know is the inferior mesenteric vein, right? How we identify inferior mesenteric vein is that it goes vertically downwards to reach the area of the rectosigmoid. There is a vessel which goes vertically downwards. It is already there on your screen if you can make out. If you cannot, I'll show you in a minute. So trace this vein now, and you will see that it is traveling in this way. So that structure, this one, follow the arrow, is opening into the superior mesenteric vein in this case. It is opening into the superior mesenteric vein in this case. This is the inferior mesenteric vein, a very important tributary to identify for surgery, right? Going here and going downward. This is how inferior mesenteric vein travels. It keeps going down towards the rectosigmoid area. So tracing it again, there you see the inferior mesenteric vein. Now the interesting part of inferior mesenteric vein is that it can open, inferior mesenteric vein can open into the splenic vein, it can open into the superior mesenteric vein, or there can be a trifurcation in this area where the splenic vein, the superior mesenteric vein and the inferior mesenteric vein, all three open at the same point. So this is important anatomy, that inferior mesenteric vein opening you need to know during your surgeries. Two branches that predominantly form the SMV are the ileal branch and the jejunal branch, and these two are very important branches that form the SMV. So you should know the two major branches, the jejunal branch and the ileal branch. These are the branches which form the SMV. Other important branch that goes is the right colic. Is the right colic branch. You can see it's going into the right colon. So right colic branch, ileal branch, jejunal branch. These are some of the important tributaries of the superior mesenteric. So So now we will see the same branches in the axial cut. As I said, you should be able to see the branches in all cuts. So now you already know that we are going to see the splenic vein. So this is the structure which is splenic vein. This is the splenic vein. Okay, splenic vein which is joining the portal vein. There it is joining the SMV. So as we go down, this is the SMV. We go down is the SMV. The only posterior branch to SMV in this area is usually the first jejunal vein, which is very important to identify. This one. This is how it goes. It arises from the right wall of the SMV and it goes towards the left and supplies the earlier parts of jejunum. Very important branch to identify in this area, right? Then as we go up, now we know this anatomy. The SMV and the splenic vein unite to form the portal vein. The portal vein divides into right and left. When I am in the axial cuts, when I am in the lower side, I am in the segment 5-6 area. So you will see two branches which will not unite with each other. And as I go up, you will see branches to 7 and 8. You will also see the left portal vein, which I am marking now. You will see branches to segment 2 and 3 and branches to segment 4. This is how the left portal vein is going to branch, right? And you see the right portal vein, which gives segment 7 and 8 superiorly and 6 and 5 inferiorly. So these are the branches of the portal vein. One important branch of portal vein or tributary to the portal vein or splenic vein is the left gastric vein. As sometimes in cases of portal hypertension, it can be very dilated. In this case, left gastric vein is arising from is ending into the splenic vein. This is the left gastric vein. So you should know where the left gastric vein is opening. So you should know where the inferior mesenteric vein is opening, first jejunal vein and the left gastric vein. These three are very important tributaries to know. Let us trace the left gastric vein or the coronary vein. And from there it will enter the stomach, right? It will enter the stomach. So this is the left gastric vein. In this case, it is opening into the splenic vein. You should know. So in this case, now just to mark how anatomy is there, splenic vein, superior mesenteric vein, which is formed by jejunal vein, iliac vein. Somewhere in this region and curving is the first jejunal vein, and this is the inferior mesenteric vein. I'll just mark these structures for you. Inferior mesenteric vein, first jejunal vein, jejunal branch and iliac branch, which form the superior mesenteric vein, splenic vein. These structures together form the portal vein. And the left gastric vein or coronary vein in this case is opening into the splenic vein. Left gastric vein or the coronary vein, and this finally forms the portal vein. So this is the anatomy that you can see in this patient. Now I will just move the console a bit so that you can review the anatomy. So splenic vein, inferior mesenteric vein, left gastric vein, superior mesenteric vein with jejunal branch and ileal branch, portal vein which divides into left and right. So these are predominantly the structures that we see in these cases. Another thing that we have to see is the relations of these vessels, but that we will see in our discussion on pancreatic anatomy in detail. So I hope this CT viewing series will help you in viewing your scans on your own on the console with your radiologist. And I hope that this video will help you understand the tributaries of portal vein. It can be different in each case, and I have tried to highlight some of the variations that are commonly present. So keep viewing more and more scans. Do tune in to our future CT viewing series, and we will continue having fun on the CT console. Thank you.